So today, we acknowledge the land that we are inhabiting today is the unceded territory of the Coast Salish people, as well as the Musqueam, Squamish, and Tsleil-Waututh nations. Before colonization, this land was grounds to many First Nations communities. Their land was taken forcefully by settlers who supported the colonial system. It is important to respect the First Nations communities in order to foster healthy relationships that support reconciliation. With new connections, we can learn from each other and build upon our knowledge of healing techniques to improve our own. It is common in First Nations practices as a key part of, common in First Nations communities to use traditional and spiritual healing practices as a key part of their health. Specialist healers have developed understanding of the environment and its healing characteristics, which includes plants that are often used to help heal many ailments. As a whole human, we can share information and become more knowledgeable in many aspects of life, especially health. And I'll share the link to the First Nations Health Authority, where we were able to pull in some of this information that I shared with you today. Thank you.
Thank you, Dolly. So I would like to now introduce our moderator, facilitator of discussion today, Jay Ingram. A little bit about Jay. He's hosted 2 national science programs in Canada. You may have heard of Quirks and Quarks on CBC Radio, and also Daily Planet on Discovery Channel Canada. His 19 books have been translated into 15 languages. Jay has 6 honorary degrees and is a member of the Order of Canada. From 2005 to 2015, he chaired the Science Communications program at the Banff Center, and that is actually how I met Jay. I was a participant in that program, and it was so much fun. If it ever sort of reappears at the Banff Center or elsewhere, please do seek it out. I highly, highly recommend it. Jay is also the co-founder of the arts and engineering smash-up called Beakerhead in Calgary. And also Jay is a mentor and an advisor to the Whole Human Summit, and we are very grateful and lucky to have him helping our discussion here today. So welcome, Jay.
Thank you very much, Pam. Excuse me, and considering that I'm speaking to all of you from Calgary, I should add that this is Treaty 7 territory, and the Kainai, the Piikani, the Siksika, the Stoney Nakoda, and the Tsuut'ina are all groups in this territory. It's also Métis Region number 3. And the confluence of the Bow River and the Elbow River, which is essentially downtown Calgary, bears the indigenous name Mohkinstsis. So I offer that land acknowledgement from my little corner of the world. And welcome everybody to tonight's Whole Human Summit session, Access to Primary Care and the Social Determinants of Health. These are broad topics, but we're hoping to identify and put a strong line under the most important features of the complex effort, really, to deliver healthcare to all, both in British Columbia and across the country. We're going to identify barriers that exist in our healthcare system, barriers that prevent Canadians, or at least prevent all Canadians from living healthier lives, including the difficulties that minorities, indigenous, and people with disabilities face when accessing healthcare. And most important, what we can do as a community to make all of that easier and better. We've built in time for breakout sessions where all of you watching, both participants and guests, can have your say and ask questions. Joining me on the panel are Dr. Maryam Zeineddin, a family physician and co-owner of the Ambleside Clinic in West Vancouver. Brittany Bingham, actually Dr. Brittany Bingham. She's the first Indigenous PhD grad from Simon Fraser's Health Sciences program, and she is Director of Indigenous Research at both the Centre for Gender and Sexual Health Equity and Vancouver Coastal Health's Aboriginal Health Branch. Third member of the panel is Tamara Taggart. She, like me, has a broadcasting background. She was a news anchor at CTV News, and she is here to share some of her personal experiences regarding barriers to effective healthcare and ways of surmounting those barriers. We're building the panel around 4 fundamental questions, and we're going to answer or address each of them in turn. Number one, why is access to longitudinal care, that is the kind of healthcare where you and your doctor move through your lives together, why is that so important? What are the barriers in the healthcare system that prevent Canadians from living the healthiest lives they can? What are the experiences of minorities, indigenous, and people of disabilities accessing the healthcare system? And as I said before, what I think is most important, what can we do as a community to remove barriers? Can we continue to protect the cherished Canadian idea of universal healthcare? So the panel is going to address these questions in order, and then we'll have the breakout sessions. For question one, because you haven't really met the panelists yet, we're going to give each of them a chance to address this question. Why is access to longitudinal care so important? And Maryam, could we start with you, please?
Yes, sorry, I always forget that I'm on mute versus unmute. Lovely meeting you all, and thanks for having me, and thanks for Pamela and Whole Human Summit for organizing these conversations. I think it's more relevant now than ever that we speak about this particular topic. For me, one of the main reasons I think this is so important to talk about is because, first of all, I've been a patient. I think we all are patients. And I've been a healthcare provider within this universal healthcare system for over 15 years now. And I see a lot of changes. Changes that shows that there is lack of access. We have over 700,000 BC residents really that don't have access to a family doctor or a nurse practitioner. And in order for our healthcare system to really work, we need to be able to navigate the system. And this is a very complex system. And patients are feeling lost, and they're feeling unheard. And there is this notion that we have equal care for all in Canada, and that everybody should have equal access, which makes things actually very difficult in some ways, because not every single human being can be treated equally. And that's where inequities come in,